Hello everyone, this is Dr. GERARD CUOMO. I'm here with my patient Ken. This is the lower right side where we're placing the tooth number 30 screw retained implant, and we're suctioning right now the implant body itself, getting it ready for the final process of seating this crown. And as you can see, there's just a tiny little bit of coagulum there on the left side, little red area, but that's probably for me bumping into it with my suction tip. Now I'm seating the crown in place by hand. If you notice, there's a slight gap space behind this crown, and the reason why that is because we're going to do a final restoration on number 31, which is the second molar, and give him a nice broad contact. So hand tightening number 30, asking Ken if he feels any tension or tenderness around the tooth, and he's comfortable. The other two crowns were already seated. They're awaiting the Teflon strip as well as the composite. Again, I'm going to use glide floss, check the snap. We look good here. Looking at that amalgam right in front of his crown now, and I think we're going to replace that at his next appointment. So again, I'll take out the wrench as well as the driver, and now we'll tighten down that. Here's the Teflon tape we're going to use in the next video segment. I'll show you how we adapt that to each one of the crowns to block the top of the screw head. And there's the driver showing you the star screw head that we want to protect. So all those tiny little grooves keep that composite from going in there. So tune in for that next segment, alright, because we're going to try to sum things up for you and relatively quickly in the next video on how we finish off these lower screw retains. So I'm just fishing now for that screw head in there. We know it's in there, just got to line it up, and once we do, we'll go ahead and tighten down that implant crown. And again, Ken is very comfortable. There's no anesthetic. We do this routinely without anesthetic. We know that there's zero tissue collapse on all of our cases because we've started the case with our specially made, modified screw open tray transfer copings. I've designed a special jig for these cases. You can see that on another video on how to make your own jig. We were toying with the idea of making a PowerPoint presentation versus a video, and the video won, I think. But you can also write in for the PowerPoint presentation. Be happy to send that to you as well. Now I'm just adjusting occlusion and trying to make sure that the upper plastic bridge is adjusted properly, and that Ken's going to be comfortable while he's waiting for the upper to be made. We went ahead and sent out the upper impression for a CAD CAM setup and scanning via the computer, so we didn't want to waste any time. On an earlier video, I've actually made some temporary crowns to fit the lower model to give that to the lab. We'll follow this up with an alginate, and I'll just transfer that on over to the upper impression mounted on the articulator. So you can see it's somewhat straightforward. Here we are. Just now I'm just going to take a little bit off of this bicuspid, and molar looks good. Looks like we got contact on that last molar. and just is relaxed and comfortable. It's very, very relaxing to do these cases. We do a lot of them in the office. Our in-house lab certainly has learned all of our techniques. They also have 3 microscopes in their lab. I have 5 microscopes in my office that I use routinely. And that's how I'm able to video record these clips of our patients so that you can see what we're going through on a daily basis. So we're getting pretty close to the end of this segment. Ken seems to be pretty comfortable with things, and our next step is going to be to now add the oh, there's a little bit of, looks like freeze-dried bone, and I'll get that every now and then, but that's not harming the case at all. It's just from the extraction site behind number 19. Tooth number 18 was removed, and the bone was filled in, and that will actually resorb over time. We're going to remove some of the smudges off of this case and get them ready for our bonding procedure, which is coming up next. Ken's been very patient with us throughout this process, and you know, it's easy to do. All right, trying to think if there's anything else I can lend you all. Feel free to comment on the video. We've got several more coming. Ken, I think he had a couple of hiccups, so we asked him to pull on his earlobe, and what you know it, that stopped the hiccups. So here's our paracore white. That's what we'll be filling with in the next clip. And so this is Dr. Gerard Cuomo. We'll see you next time, and at the next clip. And have a good, profitable day. I hope you all are doing some nice implant work for your patients, and having it easy. Take care.